Welcome back to Insight. Hi, I'm Hammer, and I'm joined now by Craig Maden from Stepping Up Physical Therapy, and we're talking today about vertigo and what happens when we get it.
Yeah.
So I remember vertigo as just being dizzy, and it was kind of used for a host of being dizzy explanations. What can you tell us?
Yeah, sometimes we use vertigo as a blanket term when it's really not. Vertigo has to be the sensation of spinning. There's something called dizziness or feeling off or balance issues, but vertigo you have to feel spinning. And we can help you with all those words, but today vertigo is probably the most common, so I want to kind of touch base on that today.
So with vertigo, does that mean I just can't get up, or I can get up and I'm walking like I've been out on a Friday night?
Exactly, yeah. I think I've seen you on Friday night. Yeah. But yeah, sensation of spinning, nausea, sometimes there's vomiting accompanying, you're going to feel balance issues. If you have vertigo, your balance risk raises about 12-fold. So I want to talk about BPPV, and that's the most common type of vertigo. And most people get this 1 to 2 times in their life. It's more prevalent after you're 50 or after a car accident or concussion.
Huh.
Yeah. So I have a picture of the ear here, the inner ear. So you have your ear and you have your eardrum. Past that is your 3 canals. You have these 3 semicircular canals that kind of look like C's or half moons. That connects into your cochlea, that's your hearing device. And then those little yellow things that come off that are your cranial nerves. And basically they're intaking information and outputting information constantly. They're gathering information from those structures and then sending it to the brain, and the brain's sending information back to it. So if we go to the next picture, should be a close-up of those semicircular canals.
Are we going to the next picture? We might not. There it is.
Ta-da! And then, so basically, that's a close-up. So you have this on each side of your head, 3. And you have one that points to the front, one to the side, one in the back. 90% of the time, it's the one in the back that gets affected. So inside those canals is a fluid called endolymph. And when you move your head, it moves the fluid. Kind of like a bead in a level, right?
Okay, yeah.
So when I move my head to the right, like I'm doing right now, fluid will slosh or move, and then inside those, past those canals are these sensory organs, and inside those are these hair cells, tons and tons of these little hair cells. And when I move the fluid, it moves the hair cells, like a flag in the wind. It says, hey, Craig, your head's to the right, your brain computes that, sends signals to the rest of your body to keep your equilibrium. If I didn't, I'd be all over the place.
Yep.
So what happens with BPPV is on top of those hair cells, you have something called calcium carbonate. And if you've had this, you've been called, if you have crystals in your ear. There's no magical crystals, but what it is calcium carbonate, and there's a close-up of it. Basically, it makes it more sensitive, which is good. We want to be alert and have quick reaction. Every 30 days or so, those crystals regenerate, just like your tissues and your skin, the rest of your body. Sometimes they go away like they should, and sometimes they don't, and they can travel back into those canals we talked about.
Oh, kind of get backed up?
Yeah, they shouldn't go in there. They should stay in that middle area. So if they go into the canal, you are good in school, right?
Well, semi-good. I made it here.
Okay, that's good. So you passed 5th grade. So one of Newton's laws is more mass equals more acceleration. So now you have that those particles where it shouldn't be, and it's going to, more mass equals more acceleration. So I move my head, now that fluid moves even faster. And that's going to cause that spinning. Your inner ear is saying you're moving 90 miles an hour, but your eyes and your other sensory systems are saying, no, I'm sitting still, or I just got out of bed, or I'm in the shower, I'm looking back. Or, and then the confusion causes the spinning.
Now those have to be taken out?
Yeah, we just kind of shake them really hard now.
Look, they're coming out. Yeah.
No, basically, it's the body is a miracle, and the more I learn about the body, the more I find out it's an absolute miracle. But we can do a specific testing, and based off of the test, your eyes will actually involuntarily move. It's called nystagmus, and based off the direction of the moving, the beating, we can tell what side it is and what canal it is. And then we go into a maneuver. It's a fix. It's a very slow maneuver. But we can basically, if you want to think of it as dumping the bucket, the easiest way to describe it, we go through a series of maneuvers to dump it. People come, I saw 2 patients this morning, my first 2 patients had this. Nauseated, dizzy, they couldn't drive, they could hardly walk. 1 to 3 visits is typically the turnaround time. And I love seeing this patient population. All of our therapists can see this, by the way. But this is something that's so gratifying to treat, because if you have this and you're at home and you had it, it shuts you down. 1 to 3 visits typically the turnaround time for this. It's something that it's a miracle. It's
Are there any people that tend to get it again and again and again? Maybe what they're supposed to flush away keeps going in?
There are some cases more complex that some people can get it repetitively. If it's true V. Once it's fixed, it's gone. Now, some people, and we don't know why yet. There's a lot of studies out there to figure out why people get this recurring. We're not quite sure yet. We just know it happens more in the elderly population. There are some more complex things like Meniere's disease and other hypofunction, or one side of your sensory components aren't working. And sometimes there's more occurrence of these kind of things.
It's probably good to see a professional to get an idea what's going on.
You can do that, or just go on YouTube, you know. But no, professional, yes.
Yes.
That's always the way. Come see your physician, your doctor, or you can come see us direct access. Most of the time, you come straight to us.
Thank you so much.
Yeah.
We do appreciate it. And if you'd like to check out Stepping Up Physical Therapy, you can head to their website or call 260-497-7191. You can also go to one of their 5 locations currently listed on the screen.